Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. So today we're going to talk about commonly asked questions I get for a medication called Pantoprazole, also known as Protonix. Plus, I'm going to share with you 4 things to look for if you're taking this medication long term. So what is Pantoprazole and how does it work? Well, Pantoprazole is a prescription medication that belongs to a drug class of medications known as proton pump inhibitors and is commonly abbreviated as PPIs. It works by blocking the production and release of acid into your stomach. So as a result, having less acid in your stomach helps relieve heartburn. Pantoprazole is FDA approved in adults and children older than 5 years old for the treatment of GERD with erosive esophagitis, which is damage to the esophagus from stomach acid caused by gastroesophageal reflux disease, or GERD. Pantoprazole is available in tablet form and comes in a 40 mg dose that's taken by mouth once a day for adults and children at least 5 years old. However, if a child weighs between 33 and 88 pounds, the typical dose is 20 mg by mouth once a day. And for those who are unable to swallow a 40 mg tablet once a day, you can instead take 2 20 mg tablets. Pantoprazole tablets are taken by mouth, with or without food, but is best taken before a meal. So do not crush or chew or break the tablet. It's best to swallow it whole with a glass of water. Additionally, Zollinger-Ellison syndrome, which is a rare digestive disorder that results in too much gastric acid, and other diseases that result in excessive stomach acid production can be treated with Pantoprazole. When is the best time to take Pantoprazole? You can take Pantoprazole at any time of the day you find easiest to remember. Try to take Pantoprazole at the same time each day because this might help you remember to take it regularly. You can take Pantoprazole with or without food. What if I miss a dose? If you do forget to take a dose, take the missed dose as soon as possible. If it's almost time for the next dose, skip the forgotten dose and take the next dose at the regular scheduled time, but do not take 2 doses at the same time. What are the side effects of Pantoprazole? Well, like all medications, Pantoprazole has a few side effects. Some common side effects may include headache, dizziness, abdominal pain, gas, nausea, vomiting, diarrhea, joint pain, or fever. So if you're experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Some serious adverse effects of Pantoprazole that you should be aware of include severe abdominal pain, including diarrhea that's watery or bloody. 2, you may develop low magnesium levels, especially if you take the medication for at least 3 months. Some signs of low magnesium levels may include dizziness, increased and abnormal heart rate, shaking, muscle cramps, and spasms in your arms or feet. 3, low levels of vitamin B12 may develop if you've been using Pantoprazole for a long time. Pantoprazole lowers the amount of acid in your stomach, which is needed for vitamin B12 absorption. So I recommend consulting your doctor if you need to take vitamin B12 or supplements. 4, bone thinning or weakness may increase your risk of fractures. If you use this medication on a long-term basis, you might require calcium and vitamin D supplements to help avoid fractures. Your chance is higher if you take Pantoprazole for a year or longer, if you take more than 1 dose a day, or if your doctor prescribes a higher dose. So it's recommended to use Pantoprazole at the lowest dose and for the shortest amount of time possible for your condition. And if you're experiencing any of these serious side effects, immediately call your doctor and stop taking this medication. So, can Pantoprazole interact with other medications? Yes, it can. Pantoprazole may interact with certain medications or supplements. So always let your doctor and pharmacist know about any other medications or supplements, including prescribed and over-the-counter medications, vitamins, and dietary or herbal supplements that you're currently taking. Using Pantoprazole with certain medications like warfarin or mycophenolate or citalopram may cause an increased risk of certain side effects. And like all medications, you should speak to your pharmacist or your healthcare provider about any questions you may have. There's lots of information on Pantoprazole, GERD, and other health conditions on our website, so check out our blogs in the links below. And if you have any questions, just drop them in the comment section below and don't forget to subscribe. Bye for now.